How do doctors weigh lymphoma prognostic factors? Imagine trying to predict how a disease will progress, like forecasting the weather but for health. Doctors do this by carefully looking at many different pieces of information about each patient. When it comes to lymphoma, especially non-Hodgkin lymphoma, they use a combination of clinical details, lab results, and disease characteristics to estimate outcomes and plan treatment. One of the main tools they use is called the International Prognostic Index, or IP. This index considers 5 key factors: how old the patient is, how advanced the disease is, levels of a blood enzyme called lactate dehydrogenase, the patient's overall physical functioning, and how many areas outside the lymph nodes are involved. Each of these factors gets a score, and adding them up helps doctors categorize patients into different risk groups. These groups give an idea of how likely the patient is to respond well to treatment and how long they might survive. But the IPI isn't the only thing doctors look at. Age is very important because older patients tend to have a harder time fighting the disease and tolerating treatment. The stage of the disease, which shows how far it has spread, also matters. Patients with early-stage lymphoma usually have a better outlook than those with more advanced disease. Elevated levels of lactate dehydrogenase in the blood often indicate a higher tumor burden and more aggressive disease, making it a strong warning sign. Performance status, measured by scales like the Eastern Cooperative Oncology Group Scale, shows how well a patient can carry out daily activities. If someone has difficulty moving or caring for themselves, that can mean a worse prognosis. The number and location of extranodal sites, or areas outside the lymph nodes affected by the disease, can also influence outlook, with more sites generally indicating a more aggressive disease. In addition to these clinical factors, biological markers like the proliferation rate of the cancer cells, measured by a marker called Ki67, and genetic features of the tumor provide deeper insights. The patient's overall health, including other medical conditions, and their ability to tolerate treatment also plays a role. To make sense of all these factors together, doctors often use advanced statistical models, like Cox regression analysis, which weigh each factor based on how strongly it predicts outcomes. These models can produce personalized risk scores called nomograms, which help predict survival chances at 3 or 5 years. For slower-growing lymphomas like follicular lymphoma, doctors use a different system called the Follicular Lymphoma International Prognostic Index. It looks at factors such as the number of lymph node groups involved, hemoglobin levels, and age. Recently, new indicators like how quickly the disease progresses after initial treatment and results from PET scans are gaining importance in predicting outcomes. In summary, doctors weigh lymphoma prognostic factors by combining standardized tools like the IP or FLIPI with individual patient details and lab results. They use statistical models to create a personalized picture of each patient's outlook. This comprehensive approach helps determine the best treatment plan and follow-up care, always considering each person's unique disease characteristics and overall health. Remember, it's essential to discuss these factors with your healthcare team to understand what they mean for your specific situation.